Hello, my name is Kristi Geddes. I am a registered nurse and I have been this summer. It will have been 20 years since I became a nurse through Weber State's awesome program. I totally bleed purple, always have, always will. Even though I live in Aggie territory now. I loved getting my degree at Weber State, and it has brought me back now. I do have a master's in nursing education that I received about a decade ago, not through Weber State, but I do have that degree. And I'm excited to be applying for the DNP-FNP program at Weber State. Looking over the degree courses, some of the titles of the courses make me feel really excited. For instance, the one about women's health, where we'll go more in depth there because that is what I have really specialized in. And some of the other titles make me a little more nervous, areas that I haven't really worked in, but more excited than nervous because I'm really, really excited to kind of broaden my scope of knowledge and understanding so that I can help educate patients, that I can fill the role of primary care provider for them, and that I'll have the foundation to do that really well so that I can give really excellent patient care. I work in an office right now, and it has been, I loved being a bedside nurse so much. I was the labor and delivery nurse, was like, give me all the patients with the birth plans nobody else wants. Give me the crazy phone calls. When I was a triage nurse, I loved helping with cardioversions. I've loved bedside nursing. Being in the office right now, I'm a clinical manager there, and so I help with some of the more organizational things in the office, as well as the patient care. And I have really, really liked this more long-term relationship with patients that we see from year to year, and it's just really nice to have that long-term relationship. And I'm excited to be a provider that they could come to, and we would have that long-term relationship and mutual respect for each other, that I could help affect health for these patients. So personal strengths that I have that I would bring to this program are that I really enjoy learning. I really, truly love everything medical. It's amazing the advances that we have, and it's amazing thinking about just these basics, that if we stick to some of the basics, that really is best patient care, but then bring in these advances that are so incredible. So just my love of learning. I am a really hard worker. I'm organized. I am not afraid of a challenge, which I do know this program would be a challenge, but I'm not afraid of that. I understand that it will be, but I am ready to take it on. As far as what motivated me to seek this degree, I think I kind of touched on that already, as just being in the office and these long-term relationships. The other thing that I have seen we have some patients who will go to providers who are not trained through universities. They don't have these degrees that they had a rigorous program of study, and they're coming in with not having excellent care given to them. And I thought, I want to gain the knowledge and education that will let me be somebody who patients can come to, and that they can actually get really good evidence-based care. So that was a motivator for me as well, is just wanting to add a person into the primary care provider role who has trained at an excellent university and is prepared to give great care. I do think that my professional career, obviously, it would change a lot, and I have had to think about it a lot before deciding to apply. Because I revel in being a nurse. I love the bedside nursing, the hands-on, the one-on-one, and even in the office, just sometimes I like not being the bottom line, but professionally, becoming a nurse practitioner and getting a doctorate degree to really back up that role is the very clear next step to me. That if I don't want to become stagnant, if I want to keep learning and growing, this is the next step. Highly educated and well-trained nurse practitioners affect communities. That's an easy answer, right? helping with the overall health of the community. And I love education and teaching others. I would love to be able to offer classes and in a community setting to help people better understand simple steps that they can take to improve their health. Nationally, as nurses, as we become more educated, more trained, better able to really fulfill these roles, nationally, we can be a force. We can be a force for good in the health of our nation. Globally, for me personally, I've always been interested in medical missions, and honestly, I have noticed that as I've looked into things like, oh, maybe I could do that or this or something else, and I've noticed that they want terminal degree people there. They want people who have been the one-on-one care provider. And so to be able to do that and make change globally, I need to have the education and background. Thank you so much for your time. Again, I'm Kristi Geddes. I'm really excited to be applying to the DNP-FNP program.